Namaskar, I'm Ashok Vyas. Everything matters in life, but lifestyle matters a lot. And I was delighted to see such an absorbed audience to appreciate compassionately and, of course, with expertise, Dr. Tarun Wasil ji and Dr. Nilesh Soni ji explaining to a group of community members who were taking interest in what postures might help, etc.
You know Dr. Tarun Wasil, right?
I met first time.
So what we are trying to do together is to use our strengths, combine them together to empower our family. Most of the faces here are very familiar to us. Most of you know us, individually, personally, and you have seen Dr. Wasil in the community, doing multiple, seminars, presentations, writing books. He's a great author, orator, and a superb clinician.
All of us have cancer cells in our bodies, everyone, but not everyone develops cancer. How does that happen? Because our body has enormous capacity to repair the damage done by certain cells, and our immune system can kill those cancer cells in a small number of cases, number of cells. So we can repair the DNA. Our body has the capacity, but if we have this unhealthy trio, there's impairment in that DNA repair pathway. So you cannot repair those, and there's decreased immune function.
It was interesting, and also even more interesting was the fact that there were a lot of Q&A and people were taking such deep interest. And I'll just have 1 minute because he has to run. But before that, let me have the fun. And I have one question for him. He said there should be fun in life. And it was funny. He said, I was watching my wedding video. Now, many people find that tragic. So what was funny about it?
Well, I'll tell you what was funny. I was going on a buggy. I went to get married on a buggy. And the buggy, with all the decor it had, the ghoda and in the back, there were tumblers, as the tumblers were put for decor, and I still remember that. So that was funny.
Can I say something? You can find fun in everything.
Absolutely. I would request your wife also to join us. Shruti ji, please come. So while Shruti ji is coming here, Tarun ji, how is it that one, you also have a book which has a triad of healthy lifestyle, then you engage with community members, bring all that you have learned, and what is the key motivating factor for you to do all this exercise, if I call it?
So I think it's the motivation is the public. They encourage me to come back, and my patients have encouraged me. As you know, my first book was also on patients. I had about 40-50 patient stories because patients motivate me to go out and try to do something different, not just the same go to see a patient and come home. So I do search the literature, and just to mention about their wedding again, having a good companion can relieve your stress a lot. Immune cells are supposed to take care of the cancer cells floating in our system. If the immune system doesn't work, then we have a problem. Then shortened telomeres, there are studies, at least dozens of studies that have shown that chronic stress or unhealthy nutrition and lack of physical activity has been shown to decrease the telomeres, which are important parts of the chromosomes. So we have all seen that there have been patients we have followed for 20-30 years with stage 1, stage 2 breast cancers, and they have been fine, no recurrence. All of a sudden, if there's a loss of a loved one, within a few weeks the cancer comes back. That is immune suppression. We have so much stress at that time that we cannot control our immune system. Immune system goes down and the cancer starts flourishing again. So that's one of the anecdotes we all have seen as oncologists. And this is basically showing that unhealthy trio, but if we revert it to healthy triad, then we can revert most of these changes and have a healthy outcome. We talk about smoking as one of the risk factors here,
you can see that that's number one, but just being overweight and obese is just next to that. Second one is, second most common cause of cancer is being overweight and being obese. So this is one of the things which we are trying to address a lot in the community these days. It is becoming, it is an epidemic already. And risk factors for cancer, in that graph, there was nothing about aging, but aging seems to surpass everything. Aging is a risk factor for cancer. As we grow old, we accumulate DNA damage, our immune system doesn't work as well, and there are multiple other factors, but aging seems to be one of the factors other than smoking, obesity. But there's a big difference between if, say, aging is here, smoking comes here. So it's it seems like as we are growing older, we are developing certain mutations in our cells, and we are much more prone to cancer. This is an underappreciated area, so I'm going to talk a little bit about this in a scientific way. Chronic stress affects two systems. One is the hypothalamic pituitary system, the other one is sympathetic nervous system. Ultimately, what it does is there are bad chemicals, cortisol, epinephrine, and norepinephrine. These are the three chemicals which cause so much damage. Here it just tells you that immune cells, all the good immune cells, they go down, all the bad immune cells, they go up with chronic stress. That's the message here. And at the genetic level, there's a Dr. Steve Cole, he has been studying this for last 25 years, that patients who are chronically stressed for any reason, PTSD, unhealthy environment at work or home, just being in a poor socioeconomic area, or unhealthy neighborhood, violent neighborhood, all these people have certain genome which is unhealthy, which means that the genes which are responsible for protecting us, making antibodies, they get downregulated, they go down. And the ones that cause inflammation, they go up. So there are a set of genes he has been studying in many different capacities. So this is basically, again, showing the same thing that with stress, there are bad things that happen, but if you go to a positive psychological process, they get reverted back towards baseline and normal to some extent. These are the ways we can cope with stress. It's very important. Stress is not going away, we know that. Some people have this much stress, some people have this much stress, but how we cope with it is going to make a difference, and we need to, and exercise happens to be one of the ways to relieve stress. So he paid me enough money so that I can talk about exercise. So this is the indirect evidence. Excess weight is linked to 14 different cancers. Smoking is linked to 12 cancers. Alcohol is linked to 7 cancers, but just being overweight is linked to 14 different cancers. So it's basically causes an environment which is unhealthy. These are the cancers which are linked to obesity or being overweight. Yes. So there's a difference between physical activity and exercise, and there are different types of exercises. So by definition, physical activity is a movement of your body that requires the work of your skeletal muscles. But the exercise is a structured physical activity. So it's a planned, structured, and purposeful physical activity. These are some of the types of exercises or physical activity: regular physical activity, low intensity, when you are doing for a casual walk, when you are going for casual biking. Then we have moderate intensity exercises. Squatting, I think, comes in high intensity to some extent, but here it says moderate. Jogging, and then weightlifting, and also running on the treadmill at a slower pace. High intensity is when you're doing cardio type of exercises. That's where your heart rate goes to very high levels and also respiratory rate increases. Those are some of the these are potential pathways with which exercise can help. So this is again actually based on the immune systems. All the good immune cells, they get upregulated, they go up in the body, natural killer cells being one of them. Natural killer cell is the name given to those cells that kill the viruses, bacteria, and also cancer cells. So they have seen in multiple studies that when people do high intensity exercise or even moderate exercise, there's 150 to 200% increase in natural killer cells immediately. So you can attack these. Then there are other cells. If you want, I can go with each and every one of these, but that will take a long time. But in general, the message is that the good immune cells, they become higher in number in the blood, and also they have seen that these cells, the good immune cells, also go towards the cancer cells in cancer patients with exercise. So there are some studies in Copenhagen going on right now. What they are doing is patients with cancer who are getting chemotherapy, they are being asked to do exercise 30 minutes before the chemotherapy administration, during and after. So they can see if it can make a difference. Same thing with the nutrition. We'll talk about that in a few seconds. But in general, these are the scientific ways of bringing back whatever we have known for centuries, at least in our culture. These are some of the indirect studies. These are observational and epidemiological studies. There was a study, Nurses' Health Study, that showed a reduced risk of breast cancer with physical activity. Another study in 2008, 60% reduction in breast cancer just by being physically active. A few other observation and cohort studies, similar results. And then they did a meta-analysis, and that also showed almost 1 in 5 cancers can be prevented just with physical activity and exercise. And this was was seen in both premenopausal and postmenopausal women. So these are, there's the exercise and breast cancer. Again, there are several studies being done at this time, but there was a small study from Canada. It was a randomized, which means half the participants did not do what the other half did, which is exercise here. And they did see some of the changes which can help to control the breast cancer, but this is not the best way to show the benefit. This is only the preliminary studies. So they are doing some of the studies now. This is the only study which has been sort of definitive, you can say. It was in colon cancer. This came from Canada, and they also had enrolled some patients from UK and Australia. What Dr. Cornier, he's the author here, he's the senior author. He has been studying it for almost now 20 plus years. And there is Dr. Newton in Australia. There are some programs going on at MSK, but they are very slow. They are starting at the petri dish level, and they want to go with that approach, and that can take another 10, 15 years before we'll find something. But this was the most definitive study. In this study, what they did was, their initial studies had shown that by high intensity exercise, just because of the sheer force, you could kill some cancer cells, just with that. And obviously, you had to prove that in a patient population. So it took them almost 12 years to conduct this study. What they did was stage 2 and stage 3 colon cancer patients who get chemotherapy, and then they randomized half of them to regular activity and half of them to structured exercise program. And that was very simple, moderate exercise, 150 minutes per week of moderate intensity exercise, just like walking and stuff. And what they were able to show was that 7% of the patients lived there was a 7% difference in survival at 8 years. 7 years survival advantage. Even the best drug, bless you, pembrolizumab, which Keytruda, I'm sure people have heard, one of the presidents, Jimmy Carter, had received it and it made the news. It's a $28 billion drug, and it has shown improvement in the adjuvant setting in kidney cancer about 5%. So exercise is giving you almost the similar type of benefit, but no one talks about. This was published last year in New England Journal of Medicine, which is the best journal in medicine. And it was presented at American Society of Clinical Oncology meeting last year. The next meeting is next weekend. So basically it was, but it has not made the news still, because critics are saying that it is not possible for us to motivate our patients. I think presenting to the cancer patients something which can be beneficial, you have to address that in a proper way. If you say, oh yeah, this is also available, you can do it. But that's different than telling them it did show a big benefit, as much benefit as one of all these billion-dollar medications are doing, then they will probably understand it much better. So this is the most definitive study. There's one study in Australia being done on prostate cancer, on exercise. And now we'll talk a little bit about nutrition. Yes?
Could one of the reasons be that the motivation for the exercise not being so high is because you tend to find that pharmaceuticals is if you find a cure, you don't make any money. Utilizing, that, because then the profit motives will go down, right? So
the whole,
maybe it's not a high yet, exercise is not.
You're absolutely right. The whole issue of lifestyle and disease or health is being overcome by business. If you start talking about that ultra processed food, all the packaged food has to be abandoned, the business community will tank. So that unfortunately is going to be bad for economy. So that's why we have to take the onus on ourselves. We have to go out and try to do these programs, and also patients have to be proactive. You're absolutely right that pharmaceutical company, they are coming with supplements rather than these foods. They think that they can just create more profitability by making one supplement for, say, strawberry, one supplement for blueberry. So they want people to take supplements rather than these foods, which we are going to talk about. And they don't want people to do exercise. Everyone is looking for a magic pill, and there is no magic pill that has been made available to humankind for last century, several centuries.
One of the things, and if I may, interrupt you, I think is I've learned for a lot of things based on, me from my belief system, One of the things they need to do, I think, as a country, is starting in kindergarten, an exercise program for every child. It's a mandatory thing, and it's enforced and done throughout all grades, even college, where it's not like an additional course or something, where, certain kinds of exercises that would preempt the cancer possibility,
So I guess that's a health policy issue. When I grew up in India, we used to have a physical therapy training before prayers and before any class started, we used to have all the different exercises, and I still do some of those exercises on weekends because weekdays is hard for me. These are very simple physical therapy exercises, and it moves most of your muscles. So you're right, but again, that's a separate.
And we'll be talking about it. If I may interject, we'll be talking about it more, and in fact, do some together today. All right. So just hold on to your thought in the next few minutes. Okay?
So nutrition and cancer is another favorite topic of mine. Again, we talked about that there are 14 different cancers just linked to being overweight. So potentially we can decrease or eliminate these cancers if we can eliminate obesity or just being overweight. Inflammation caused by the excess body weight is one of the possible reasons, and there's link between diabetes and cancer. There's a link between those diabetics who are on insulin and cancer. There's a low fiber diet has been linked to many different cancers because high fiber diet creates short chain fatty acids in our gut, and it changes the microbiome in a very good way, and it decreases the chances of cancer. There are studies which I will show you. Vegans and vegetarians have low incidence of cancer, but not all food vegans and vegetarians eat is healthy. I can show you all the slides. I have those, but we are not going to go there today that much. We know that there's less cancer in tribal regions of Africa, rural areas in Japan, the 5 blue zones, which we'll talk about a little bit, and some ethnic groups in India, such as Jain community. And however, when all these people, even Japanese, they move to the US, within 10 to 15 to 20 years, they are at the same risk as Americans. So there's something to be said about the environment. These are the 5 blue zones of longevity where many people live up to 100 and they don't have any such disease such hypertension, cardiac disease, cancer, or even neurodegenerative diseases. So we are people from Harvard, people from other bigger universities, they are going back to these countries and trying to study how their lifestyle is, and if we can make it implement some of those here and help our population here at home. And this is a study which I'm a participant of. Actually, I have sent several patients to MSK. This is basically a condition where there's increase in plasma cells. It's not to the extent that it's a full-blown multiple myeloma, which is a disease. This is monoclonal gammopathy. And in that, we don't do anything. We just monitor patients because many of these patients will not develop a serious problem. I have 150 patients right now who I'm just monitoring. I don't even call them patients. I call them some people with some abnormality. In that, this is a study which Urvi Shah is doing at MSK. She is providing 12 weeks worth of plant-based diet. They give you the diet to eat, no restriction otherwise. Whatever you want to do, you can eat otherwise. But this 12 weeks of plant-based diet, and they are studying their bone marrows, blood, urine, and stool before, during, and after. They published their result on first 20 patients, and they were able to show that 18 patients, the protein which we measure for this disease was stable. In 2 people, it was going up, and when they went on to this trial, it flattened. So, and it was very feasible. So it's plant-based diet, and I've had discussions with Urvi so many times that we should include exercise and stress relief with it. But again, scientific community does not like to combine things. They want one thing at a time. So, but they were able to show that there is some initial evidence, and in the largest study now they have enrolled I think 200 patients. This was 20 patient study. So hopefully we'll get the results of that within next year or 2, and that will give us some evidence that nutrition is helpful.
On that slide, it says SMM, is that smoldering multiple myeloma?
SMM is a smoldering multiple myeloma.
Because I know a couple of people that have that. I know a family where my close friend has multiple myeloma and saying is that if you're on a plant-based diet, it shows that there's no
There's early hint that we can prevent progression to multiple myeloma, very early hint. But again, if they want to participate in the study, it's still open. The latest patient I have sent is about 2 weeks ago. I think she can benefit from being on plant-based diet. Yes, I think so. And CAR-T is a very good addition to our armamentarium for treatment for multiple myeloma. It is helping a lot of patients. So, but this is some study, and let me just go to the next one. This is a dietary intervention in prostate cancer. So, we all know that the prostate cancer is the most common cancer in men, and there are, if we all reach up to 100 in the United States, probably all 100% of us will have some prostate cancer in the prostate gland itself. Not everyone has a problem. So there are patients with very low risk disease where we just monitor them. We don't do anything. So this is a study they did on 220 men who were like that, very low risk, and their PSAs were high. They had documented prostate cancer, Gleason score 6 or less, and they randomized them to some dietary intervention and regular diet. And what diet was? It was pomegranate, cranberry, green tea, broccoli, ginger, and turmeric with black pepper, curcumin. So this was the intervention. It was in Australia. This is Dr. Thomas. And what they did was, in the intervention group, they also subdivided them into some people who had an additional 3 things, which was enolic acid, vitamin D, and another compound. So in one capsule arm, what they saw was that the PSA increase was slowed in 28% of the patients. When that subgroup that had 9 ingredients, 6 plus 3, there was 42% of the patient has slowing of the PSA increase. Overall, 92% of the patients stayed stable, but in those patients out of 100 who had no intervention, 8 out of 100 developed progression of disease. On the intervention arm, 1 out of 100 developed progression of disease. So that's another evidence. So there's a tablet which they made, PAMI T. It's available online for last 12, 13 years. I've been telling my patients, pomegranate, broccoli, ginger, turmeric with black pepper. It's a combination of that, and green tea. So you can supplement with a tablet, or you can have these compounds, and that can decrease the chances of prostate cancer.
I have a question.
Yes.
There was also a research study done in Chennai for prostate cancer amongst different types of people, meaning, without discriminating, like Chinese people, Indian people, 2 types or 3 types of Indian people, North Indian, South Indian, Americans, I guess various, places from the world. At a particular hospital, and I forget how many, it was a very large research study that I'm not sure if you're familiar with that one. They found that PSA numbers can be very high amongst certain people, and it's normal, whereas other people, like in America, the numbers can be considered a lower, like I think less than a 4 or something is considered reasonably normal on PSA. So what winds up happening is that the levels are not the same across many different groups of people. And this is something I'm not sure if the studies are looking into, are considering.
So I think we need to look at that study. I'm not aware of that, to be frank.
Yeah, it was done in India. It's in a big hospital. They actually read it a short while back.
We have to compare apples to apples and oranges to oranges. That's number one. There are certain factors which can increase the PSA. We have some patients who have routinely PSA of 20 because they have prostatitis. So you can't really say anyone, and there are certain factors which have to be taken into account. And for study purposes, if it was a rigorous study, it would have made the international news to some extent. But one of the problems can be that they just took all comers and did not sub-stratify them with the size of the prostate, because doing MRIs is very difficult in India. It's not cost effective most of the time. So if you want to do such a study, it will take a lot of effort and money. So you have to do the MRIs of the prostate, maybe prostate biopsies in several of them, and then just the PSA measurement alone may not be enough, because you have different sort of sets of patients than you are studying. So then you cannot make any generalized conclusions, in my opinion. So calorie restriction is something which Jain community has been doing, and many of the other Indian people and Muslims do it during Ramadan. But one of the things which we have to remember is that fasting is good, calorie restriction is good, but afterwards if you do binge eating, that's much worse. So calorie restriction is the only method that has shown longevity and healthy lifespan in mice and monkeys. Human studies are ongoing right now. Dr. Walter Longo is the one who is studying these aspects for last 25 years. He's out in California. But this is the only way we can show that at least mice and monkeys live longer and healthier. Plant favor does not mean vegetarian or vegan by any means. In general, we have to have a variety of foods, because our microbiome needs different bacteria, and there are 30 to 40 different vegetables and fruit we recommend. Mainly vegetables, some fruit, because fruit has sugar. We want to avoid refined sugars all the time, red meat, and also ultra processed food. But at the same time, if you want to eat healthy vegetables, fruit, seeds and nuts, and then all the lentils, legumes, mainly plant forward. Red meat is a no-no, big no-no these days, or minimize it as much as possible. So basically, if the person is not allergic to any of these, it gives you a very good variety of bacteria in the gut, and that can increase the short chain fatty acids and also improve the health of a person. And this is a little bit of about information about healthy plate. Most of the people know about it, but unfortunately we don't practice. That's the problem. And this is what to avoid and minimize. See, these are called feast foods, several of these, such as mithai in India and samosa, kachori, pizza. These were called feast foods. So feasts used to happen once in a while. We have made it a habit of bringing it almost every day. So that's the problem. So feast food should be kept as feast foods, maybe once a month, a little bit of this stuff. And we need to have a balance between energy consumption and energy expenditure. That's where exercise comes in. 2 slices of pizza, you have to walk, brisk walking for about 100 minutes to get rid of that. I will bring now Nilesh into the picture, because he's going to talk about all the exercises. So this is 3 pancakes with some syrup, little bit syrup and the cream. 820 calories you get, and you have to do so much exercise to get rid of those calories. And these are the foods with the amount of calories. And these are some of the common Indian foods you can see. And these are the drinks. Water has 0 calories, but no one wants to drink it. Mango lassi, 150 calories. So, and not most of us want to drink 3 or 4 glasses, not 1 glass. And these are the seeds and nuts. They have calories, but these are better calories. These are not the bad calories. And these are the exercises to burn those calories. And so my message is that if we can go back to where our forefathers used to be, stress-free to some extent, or coping with stress is important, plus healthy nutrition. When my grandfather I used to watch him that when his friends came over, they used to 5 kilos of fresh vegetables and fruit, they will just eat 4 of them. What we did was bring samosas, kachoris, bhaturas, and puris, and other fafda and other stuff, and that has harmed us. So this healthy triad can prevent cancer, in my opinion. Triad along with the standard of care treatments, we can have better outcome, which we are seeing in prostate cancer to some extent. There is some evidence, and colon cancer, we talked about exercise program, and prostate cancer is being done right now. And so basically we can have a better outcome with this healthy triad if we stick to standard of care treatment plus healthy triad. These are some of the messages. We are what we eat, digest, and absorb. It's very important. And staying physically active and have a purposeful life is very, very important. We are what we do. We are what we think. If we are always stressed out, that affects us. And also, we have to have a good company with good habits. So I have a couple of slides on that also. These are some of the messages which, again, eat less often, eat fresh, eat whole foods. That's the message. Limit the number of calories, get your calories from healthier food. So if I get asked about this question in many of our medical meetings also, that we are here to enjoy, we want to drink, we want to have bhaturas, we want to have. So I tell them, do it, then just go to the gym for 4 hours, 5 hours, and burn those calories. You can't just keep those calories inside, because that is the most harmful thing that causes insulin resistance. So there are ways to, again, balancing is the issue here. And these are some of the other hints. Okay, so this is so pharmaceutical companies or nutraceutical companies are pushing for, and there are so many physicians as well as dietitians who are pushing for these. So I tell them, if we are saying that you should have 30 to 40 different vegetables and fruit every week, and seeds and nuts, all this different kinds, you have to come up with 40 to 50 different capsules, because you can't put everything in one capsule. So you have to have a burger which consists of these. And this is a good company with unhealthy lifestyle, although they are all laughing, but the genes are telling us a different story. It has been studied. People who have good time but with unhealthy lifestyle, their genome does not look good. On the right side, if the person is in a good company with a healthy lifestyle, the genome looks much healthier. So that's, I think, it.
Give them a big round of applause.
Questions?
Yes,
Why can't we? Because he's 11-year-old and he doesn't listen, or?
Yeah, because he doesn't feel, he feels just you are watching his eating while, you know.
I think, again, counseling helps. You can bring him to me, I can talk to him. We can have other counselors.
My other question is, if genetic.
How do we know it is genetic? Because he's not overweight or obese.
Right.
So how can it be genetic?
But my parents are genetic. My father is overweight or.
Genetics plays only 10 to 15% of the role in most circumstances. So 80-85% is just that easy availability of food, 24 hours a day, availability of food, and lack of exercise. These are the things which we are trying to address. Genetics, unfortunately, if the person does have hereditary condition, then obviously there are medications. I'm not aware of any gene therapy that can help at this time, but I think again trying the healthy triad is still helpful.
And I may add, so I know your dilemma, that the thing as a mother or a grandmother or a family member, the dilemma is being nice or being kind. So in my opinion, being nice is, beta, eat, whatever you are, I'm accepting as you are. And being kind is being tough with the person and say, discipline. These are the requirements. If not, more trouble is coming. So I would not let you, overeat, or I would make you exercise, or I'll get you into groups where there is physical activity. So I feel even we see it in our families, our friends too. So I feel being nice helps. It goes a certain mileage, but being kind on a purpose will definitely help. So I've come across many individuals, young, old, being able to control and totally rewire their energy. Right?
I think again sending into in a group where he can get motivated and see the advantages of exercise, advantages of good eating, and being stress free, that can be helpful, in my opinion.
I want to say that you talked of many studies which were conducted where you said you introduced a little bit element of vegetarian food and you did not change anything else. But to my mind, to really determine a causal relationship, you have to keep everything else the same. So what do you know that one person who benefited from the vegetarian food may actually have done more exercise?
So if you are giving,
or may have less stress.
Okay, if you are
there
giving
are other factors too.
No, so we cannot control for stress. We cannot control for the exercise because again they didn't want to do sort of mishmash. If you are giving 1500 calories to a person and that person is eating that, do you think that person is going to eat something else? 15 to 100 calories the person is getting, they give you food and you have to eat that. So they did not calorie restrict. If you wanted to eat some pizza or something once in a while, that was allowed. But if you are basically filled with the diet which you, the institution is providing, there's not much room for anything else to be added, in my opinion.
So I may add on to what he's just saying. You are right that there are other factors affecting the study besides vegetarian diet, but the doc is pointing out that considering those factors are still playing in your life to a variety of levels, high, low, high stress, low stress, having such diet, having such vegetarian diet or having control on your diet is definitely helpful. So that is the message out of the study.
No, I don't doubt the fact that this kind of diet is having a positive impact, but I'm saying the study results are at best just indicated, because you cannot keep all other factors
that
the same.
I said before, it's a hint.
Yeah,
I did not say that this is it.
Yeah, because a true causal relationship cannot be determined.
No,
Right.
this is just.
Please give him a big round of applause. And thank you for your patience. So now there are a few things. I may ask a few things. One is, so we all know that there is a benefit of exercise, and it is so vital that you can decrease the risk of cancer, right? You heard from the doc, we have evidence-based studies. So the question to all of you is, how many people exercise on a regular basis? 2, 3, 4, 5, 6. Yeah, so there are few here who are not exercising, right? So the thing is, we all know all this good stuff. There's awareness everywhere, right? You have social media, you have all the yogas, you have YouTube, you have doctors, your doctors telling, your friends telling you. So let me ask you, why are we not doing? Why are the lifestyle diseases still increasing? Any clue?
Laziness.
Huh?
It's that laziness can cause a lot of issues.
So we have all the knowledge of the world, right? We have, but why still our lifestyle diseases are increasing? So there is something missing, right? There is something which is sort of which can be corrected. So it may be you're thinking you're exercising. The doctor was just Dr. Wasil was mentioning activity and exercise. There's a difference. So you know, I grew up in India. I've seen my parents and their their age group going for a walk after a meal. Now that's the form of activity they prefer to do after a meal. And then they say, I did exercise. Do you agree?
No.
So how many people do activity and how many people do exercise? Right? And so that's the consideration. So why the other question to ask you, if you all, half of you are doing exercise, if you half of you are doing exercise, why are you not getting results? Any clue?
Not doing enough exercise.
So calibrating it to getting the results, right? If we go to a party, we have a meal which is like 3 portions, 3 times your usual portions, and then you say, okay, today I ate a lot. Let me do the treadmill for 30 minutes. What will happen? How many calories will you burn after doing treadmill for 30 minutes? Any guess? Half a slice of pizza? But mentally, what do you feel? And I've seen that on the cruise, right? You go to cruise. Have you ever taken all inclusive cruises, right? You pig out to the for the ice creams and the pizzas and the main meals, and then when everybody's sleeping, like, I'm going to be active. Let me go for a run. I run for half an hour. I'm back to eating, and I'm thinking, oh, I did exercise, right? So coming back to it, I don't have too many studies to talk, but I wanted to just bring this to everybody's sort of attention. Doing exactly what you're thinking, following and doing it consistently. That is one vital link which we all have, sort of have to establish a little better than where we are, right? Do you agree? Yes? No? Yes. All right. So then why don't you stand up? Let's exercise here. Just stand up. You can put on the lights for me, please. Tanu, put on the lights. The other one. Yeah, there you go. Oh, now everybody woke up. So the doc gave you so much info. So let's act on it, right? Now I wanted to see if you are really paying attention to what people teach you, right? So just mirror me. Whatever I'm doing, just do it, okay? Ready? Yeah, you can. Everybody can do it. Yeah, you can do it. Because it's such an easy thing to do, right?
No, you can do
because you're gonna mirror. Now this is just to wake you up because you've been sitting for a while, right?
You can do Shah Rukh Khan.
Oh, Shah Rukh Khan, yeah. But anyways, so let's do this. So easy.
No.
Okay, just follow me. So how many people are listening to me? Everybody? Yeah. Follow me, okay? So what's happening to you? What's happening to you? So what's happening to you? This is just a very simple example. You think you know how to move. And I'm just showing you in 30 seconds, less than 30 seconds, that we don't. That's the reason when you feel that you are doing exercise perfectly, think again. Go to an expert. We go to school for 15 years, 20 years just to learn how to identify issues with your body and then help you exercise correctly. So what is the value of going to a professional, to an expert? This is the value, understanding and learning how to move correctly. Now, what I was just showing is very simple, right? Let's do what our lifestyle does with our spine, right? What's happening right now with our spine? We've been spending too much time on the screen, either it's the phone or the tablet or a laptop, and that leads to changes and tightness in our body in certain parts, right? And everybody has a different habitual sitting, standing, walking, a way of moving, right? However, all of us can benefit with 5 simple things which will help you mobilize your spine and yourself a little better. So we'll target that together. does anyone over here want to become a guinea pig? We can give them a thorough assessment, and we can give a specific protocol to do at home. Anybody wants to come? Okay, come in. Come in. So, well, very good. So now everybody, let's do a evaluation together. What is your name?
Anil.
Anil.
Anil Jain.
Mr. Anil Jain, right? So let's evaluate Mr. Anil Jain for a moment together. From the front, does he look handsome? Yes? Guys, give him a compliment.
Thank you.
Now just turn around towards me. Now watch him from the side, right? Now again, and watch me from the side. Obviously he has more hair, but other than that, watch him from the side, right? So watch the tip of his ear and the tip of his shoulder. Right? Good. Now watch again. Watch both of us from the front. Go ahead, turn around. Watch his shoulders. Watch his shoulders. Right? Right. Now, third thing. Watch the legs, like his knees. How he stands and I stand. Which leg he is putting more weight? Anybody? Any clue? My staff? Anybody has any clue? Right? So you saw there are a few things. One, me and him have a different way how we put our head on our shoulders, right? Somebody having a little more curve, somebody having less curve. The way our shoulders appear, the way we bear weight. What I'm trying to impress that even this simple stuff can lead to unequal use of your body, unequal use of your muscles. Now relate that to these things, what you have on the screen. If you sit around too long, if you're holding a device, holding your neck down too long, if you are just not even using device, just sitting down for having tea, discussions, meetings, work, or leisure, right? If you're sitting too long, there are certain parts of your body, they will get tight, they will get weak, and there will be a unequal force applied on your body when you move. Do you agree?
Yep.
Now, I'm not giving you any scientific like randomized control studies. What I'm saying is just use common sense. These things will make you exercise. Then you will start exercising, right? So looking at him, I'm going to do a on-spot protocol for him. Let's just help him to look better. He's handsome, make him even better, right? So what I would, anybody from my staff, can anybody suggest correction? What correction would you suggest? Come on, Karan, come in. Jump in. What correction would you suggest for Mr. Anil? Neck exercise, right? So what I would do, I'll give you another clue for everybody. Think of a pole, a straight pole, right? If for the pole to stand straight, the strings applied, they have to pull equally. Yeah? For the pole to stand straight. Now think of that pole leaning forward. What will happen to the string in the front? It will get small, tight. The back string will be lengthened. Can you visualize that? That over a period of time leads to changes in your spine and how you bear weight on the spine, right? So if we want to correct, let's correct those strings. How we elongate the strings which are tight and strengthen the strings which are weak. Come on, just show it. Come on. You know, you've been doing it all day long, right? Every day. So show him how to do pectoral stretch.
Okay.
Go ahead.
Against the wall?
Yeah, against the wall, against here.
Against the wall?
Yeah, you can do it on the glass. Nothing will happen.
Okay. So you're gonna turn around. Place two hands on the glass. You're gonna push yourself back. So much better. You can do it with one hand first. You can place one arm on the door panel and just push your upper body ahead.
Okay.
Go ahead.
Oh, yeah.
Yeah, move your your left leg forward, okay, and move forward. Now, do you feel any stretch anywhere? Let me know. And around the shoulder, right? So you can do, Miss. I'm just helping Karan to straighten up a bit. Okay, very good. Now let me show you one more. So come this way. Okay, this is one. The other one will be using both hands, right? So you're putting one leg in the front, one leg at the back, and then moving forward. So at any door, right, in the home,
Yeah.
and you'll feel a stretch in the front of your shoulders. Okay, go ahead. Look straight and move forward. Where do you feel the stretch?
In my shoulder.
In the shoulder, in the front, right here, right?
Yeah.
That's where you feel the stretch, right?
Yeah.
Look up and relax. Come back. Now do one more time. And come back, right?
Yeah.
Come right here. So it's a simple exercise. Now you can relate. Anybody having round shoulders or sitting like that can do this simple movement, right? You want to do. Everybody knows the chin tucks, right?
Yeah.
You have seen it on the TV, yoga. You've seen so many times, right? He can benefit with that. So anything to move his neck backwards would help him. Can you suggest anything more from the audience or from my staff? What else can you help him with? Shoulder retraction. So let's do it together. So you can turn around on the side like that and bring your elbows next to your trunk, right? And bring the elbows back, all the way back. Look, keep your body straight and bring the elbows back, right? Straight back, forward. Bring it back, forward. Again, bring it back, forward, right? One more time. And relax. So again, you feel that the muscles which are, the strings which are pulling you back, they are engaged, and the one in the front, they are getting stretched, right? Third one more. Can you suggest one more exercise? Okay, rolling the shoulders forward or backward? Where would you roll? Backward. So go ahead. Up and back. Bring your shoulders up and back. Up and back. Up and back. Up and back. So he did 3 exercises, right? One more. We said 5. We'll give him 5. So this is 3 exercises. What else can we do? Posture. We'll develop posture. Can he do something with the wall, with his neck? What do you do with the neck? How do you do neck extension?
Sit-up.
Huh? Sit-ups? We'll do sit-ups too, but not for him.
Just
Chin tuck?
Yeah. Keep your back with the wall and then just make a squeeze like this.
Right. That is a good setup, but I'll borrow the chair.
Okay.
Can I have the chair? All right. And Mr. Jain, have a seat here. And can I get a small, that half roll, the green half roll? So you can use a small pillow, a roll of a towel, and put a paper tape on it at home, right? Okay, come back. Okay, come back. Okay, okay, and then you can. Actually, this is a little longer for you, but just okay. Now push on it backwards. The chair is not flat; it's curving, so the bolster is going a little curved. But push back from here, right? So, क्या करना है? When you are sitting, you are leaning forward like that, right? But if I put a little support in the middle of the back, you come and extend, like that. Okay.
Yeah.
Okay. Go back, relax, and come back. Now it's a little difficult when you start, but think of putting a roll of towel under the upper body, like where your scapula, your shoulder blade ends, where they end, right around that area, right where your shoulder blade ends. Put a roll of towel and push it backwards. So you'll be able to elongate your spine, right? Go ahead again. Do it again. Now what he's trying to do is pushing himself totally back. So, but it will come little by little. Okay. Relax. Okay. Go again. And the last one. Okay. So are you getting this, guys? Yeah. Otherwise, I'll show you one more. You can all have a seat. Let's do this one together. I think we just recently did this. Okay, relax. Now put your hands on your knees. Okay, okay, and think somebody is pulling you from your head towards the ceiling. Right. Try to elongate your spine. On the front of your perineum, put pressure.
So when you go to a party, how would you show up your jewelry, your expensive jewelry? How would you show it off? This is the way. You correct your collarbone. Think of a hot tea is put on a shelf coming out of your collarbone. If you lean forward, the tea cup is falling down. If you lean backward, the hot tea is coming on you. So how would you keep it level and not let it fall anywhere? This is the way. Now the way he's sitting. Now how long can he sit like that? How long can you sit like this? Hardly. Then is it good to sit like that all the time in the party? Like I want to show off my necklace throughout the party? Not possible. It's not possible. But you can do it periodically. So what you do is you assume this posture, you hold it for 30 to 60 counts, and then go back, return to your normal posture. So as soon as he returns back, he loses a little height. You see that? So try it again. Put your hand, try to be tall, push, and hold. Now, I can show a little animated version of it. If I do next, oops, sorry. If I do in front of him, I'll be sitting like this, right? See, most of us, the way we sit, we try to have a little sort of a curve in the lower part of our back, right? So what I want you to do is, out of that, put your hands on your knees. You move your pelvis forward, like you're putting pressure on the perineum in the front of your body, right? You're putting pressure there and then gaining height. So when you do that, what happens to your lower back? What happens to your lower back? You stretch, right? So if you get tired in your back sitting too long, this is what you want to do, right? So not only you can show your necklace, you will be one of the strongest person on the table. See the way he sits. Does he speak more about his confidence or less? Now watch. Now just what, I'm going to be a little offset from him. He's sitting like this somewhere in a party, versus I'm sitting next to him like this. Whom would you sort of relate in terms of power? So you're absolutely right. So what I'm trying to tell you is, posture is power. So it's not the necklace or the clothes you wear, it's how you carry yourself, right? So you can relax.
He has to show power now.
Okay. Now do it again. So put pressure on the front of your body. He's a very quick learner. Now, I showed him 5 tricks of changing his posture. The thing to do, what the doc was just talking about, is we have wealth of knowledge. We have evidence. We can beat a serious disorder, cancer, right? The doc is saying that it's doable. It's as good as taking some multi-billion-dollar medication. But it's our consistent approach and then believing in ourselves, like you can do it, right? That is the main thing. That's what's missing. Calibrating the intensity and the frequency of an exercise, finding out what is the right exercise to do, and then doing it consistently is the key of keeping healthy. Now, he can do any exercise. He can run a marathon. He can be on the treadmill. But what we just showed him will improve the health of his spine, right? So that's what you want to do for yourself. All of you, if I take a picture right now and share it on the screen, everybody here, 15, 20 people, everybody's sitting differently. And now, as we spoke, everybody's sitting a little tighter. That's a different story. But everybody has a habitual posture. And that habitual posture can be sort of worked at. I cannot make him 16-year-old, but I can definitely make him better in terms of spinal alignment. Right? Good? All right. Come. Give him a big round of applause. Understanding the spine, and I will not go into the too much of the nitty-gritty of the medical lingo of it, but just understand the spine has 3 curves, right? When we stand from the side, the neck spine is curved in the front, the middle spine is curved in the back, and the lower spine again is curved in the front. So it makes like an S for Sony. It makes a curve. But that curve has to be maintained while you sit, stand, sleep, walk, jog, climb, right? Closer to that normal alignment. Now, this is not the whole curve, but the picture is showing you that these are the parts of the spine. So what you see, a brick-like structure, that's the bone, right? In between the Dunkin' Donut, everybody's hungry now, right? The Dunkin' Donut, so that's the jelly, what's called the disc. And then you see the yellow structure, they are the nerves coming out of it. Now, as we age, as we habitually use our body, there are changes up there. And you can minimize those changes. You can reduce the stress on those structures by doing simple spinal alignment exercises. So what you learned from me today, if you practice, give yourself seven weeks and you'll see a change in your posture. How would you notice? You take a picture today, ask your family member. Don't tell them anything. Tell them to take a picture in standing and sitting from the side. You look on the side, just don't overcorrect yourself. And practice the exercise for 7 weeks and then ask them to do the same thing. Take a picture from the side. And you will see your ear, instead of falling down, it's falling closer to the tip of your shoulder. You'll see the change in itself. Now I'll tell you one thing. If you lay down in bed today, anybody here, because the weather is bad, you go lay down for 24 hours. Don't get up, just relax. You'll notice the increased effort to get out of the bed next day. Am I right? Yes. There's something called deconditioning happening to you. 24 hours, very less time, and your body starts weakening. Yeah? The reverse is true too. If you start putting effort, you don't notice it. You'll not see that you're becoming a muscular man or woman, but you'll see the change in the effort you have to put in any activity, right? Transitions means getting out of the bed, getting out of the chair, getting from car to your kitchen with some weight, walking in the mall, standing at the kitchen counter. All those activities will change, right? If you exercise, that is the guarantee. So people, why people don't do consistent exercise in spite of understanding the benefit of exercise? Any guess? Why don't we do it?
As a habit, I think we are lazy individuals. As a community, as a human nature, we want comfort.
I was one of them. I'm not kidding, and I'll admit, in my 40s, I would preach people on the importance of exercise, but I would not seriously do it for myself. And I see, if I go back and look at my pictures 10 years ago or 15 years ago versus what I know I'm now, as Dr. Wasil is saying, consistency is what is at play. Now that defines your character. Basically, you're preparing to go to a doctor versus avoiding the doctors and using that time for a purposeful life, right? Now we're talking about happiness. I just had that discussion in the morning. I just discussed about kindness and niceness. You understood that? That way happiness too. Are you happy when you see somebody skinny, fit, walking in beautiful clothes, and you having a thorn and rounded shoulders? Are you happy to see that person and your own reflection in the mirror? Are you happy?
Yeah.
Happy?
No.
Are you happy?
Like this person who is there.
No,
We are not. We are not happy. But then, so the thing is,
Yeah, right. But I'm happy to see him.
the thing is, what are we doing for it, right? Besides, that shade of that suit was not the best. What are we doing for ourselves? That's the main thing. So exercise, when we talk about exercise, it takes some guts and action. And I guarantee you one thing, the doc already presented so much of evidence-based studies, but self-experience, anybody who has been in touch with me, exercising will definitely change your life for the better. And if you have ailments, if you have postural, abnormalities, if you have any pathology, if you have degenerative joint disorders, if you have spine pain, you take help from experts. Now, I'm not the only one practicing physical therapy, but what I'm trying to impress upon is
take help from experts. You have Google and you have YouTube. We have the same thing. Would I, if I have stomach pain, will I just Google off what is the reason of the stomach pain? Did my wife feed me something?
Yeah.
No. I go to the doctor. That the doctor is expert, right? So same thing. You learning exercise from experts it's a great tool to be on the right path in terms of fitness, physical fitness, right? Any questions so far?
Can we do those 4 exercises one more time?
Oh, yeah.
They washed off already.
5. We did 5, but we'll do it together.
Yeah.
So the take-home message for you is these are the exercises for the whole group. So these things, we'll do it all together. Are you ready? What you have on the screen? Let's do what I showed Mr. Anil Jain first, and then this was I prepared this exercise for everybody here. Why? Because this is applicable to everybody who sits for too long. What you have on the screen, right? This is applicable to everybody. You can do it whether you have knee pain, hip pain, back pain, neck pain, any pain. So these are some simplest of stretches and movements which you can implement to jumpstart, getting into exercising, right? But let's just repeat. Come, I'll repeat it for him, and then we'll do all of this together. Okay, 5 more minutes. So, can anybody show me what we showed him? Come on. So the first one was the stretch, the stretch of your pectoral muscles, right? So you can do it on a corner of the house, a room's corner, or the doorway, right? So put your hand in the line of your shoulder, put one foot in the front and the other one back, and then gently move without moving your head too much or your back too much, right? And you'll feel a stretch in front of your collarbone. Now, everybody who's rounded shoulders can do it, okay?
Should we alternate our feet? Or
You can do it, alternate foot, or preferred foot. The way you're feeling better moving your weight forward, you can use that.
That's it.
So you feel a stretch here, right? You hold the stretch for 10 to 30 counts, okay?
Is it necessary to have the feet forward if you can balance your weight? Is that
No,
okay?
that movement forward is causing the stretch. If you just hold yourself, you're not causing any
No,
stretch.
I'm saying as you're moving forward, if you keep your feet level without stepping forward.
No, it should, because it's protecting your back.
Okay.
It's a great question. Why? Because I don't want to hurt his back while he's getting his shoulders fixed. So that's a good question. Yeah, you don't need to lean forward because that causes too much stress on your spine.
The reason
Right?
I ask is I did this before I came here this morning.
Yeah, no, not putting 2 legs together. No, that's not the right way. Moving one leg forward will prevent excessive stress on your spine.
Okay.
The second one, guys, anyone else? He did one well. The second one, okay, we'll take that. Rolling the shoulders backwards. So whenever you're a little angry at your spouse, just roll them backwards, not forward, okay? Don't roll them backwards.
While she is rolling forward and you are rolling it back.
No, backwards, up and back. Watch, up and back. So remember to back, just bring him back, yeah, bring him back.
She is here and it's being recorded. So just
Oh yeah. Just be careful with your other family members will come, and my family members are right here. So, okay, that's second. So the third one, guys, come on. There are some
Towel thing.
So yeah, you put a towel in the middle. Again, I'll borrow a chair, or it's fine. But basically, sitting and thinking of stretching your back up, right? So basically, you're collapsing in the middle of your spine. So from there, you're straightening up. And to straighten up, you have some, like a roll of a towel or a, small bolster. That will help you straighten up. Right? 3, 4. Excellent. So this one, you put your hands, you put your elbows closer to your trunk, side of your body, and bring your elbows backwards. Backwards. Right? You feel the stretch? And the last one was the $1 million necklace one, right? That everybody remembers. You remember that sitting? So that I would advocate for everybody sitting here. As I told you, when you go to a party, start your party like that. Why? Because you're avoiding.
So what do I have to show by sitting like that?
Oh yeah, so what you're doing is you're avoiding cumulative stress on your spine. Cumulative, just in simple words, layers of stress. Your pain, a little more pressure, a little more pressure, a little more pressure. It keeps on building if you keep on sitting too long. You went in a car to a party. You sat and ate. Then again you're discussing some functions.
Everything is sitting. Here too, that's why I made you stand up, because some of you are dozing off while you're listening to it. But that happens when you sit too long, you have stress on the spine. And doing that posture will try to break the cycle of stress on the spine.
So
Good?
Should
we use
the
stretching band if it's good?
I'm sorry, just
Should
one.
there be a slight curve to your lower back when you put your shoulders back?
Yeah, so that is the one we showed. It is meant to cause the pelvis to tilt forward, and that is giving you the normal curve. What you were talking earlier, the neck is curved forward, the back is curved forward, the middle spine is curved backward. So that normal curve, it is supposed to align you to the normal curve when you tilt your pelvis forward, right? So yeah, it's gonna give you that curve. Doing that movement is bringing you closer to your normal spinal alignment. That is the reason you did it. So that's the right question. Yes.
When we do the shoulder retraction, should we use it is okay to use the
Rubber band?
Rubber band?
No, so the thing is, okay, we'll go a little more into the mechanics of exercising. If I pull, I'm using some muscles, and if I just do without holding anything, I'm using some muscles. There are different muscle groups and different actions. So I'll give just simple understanding. If there are nothing to pull, right, the strings at the back will bring my hands backwards. And again, the strings in the front will bring my hands forward. So this is the same, like two sets of strings moving in. But if I have a rubber, then the strings at the back have to sort of shorten, and the same strings have to lengthen to let go. So it's a different exercise, even though the movement looks the same. So I don't want to confuse you with a lot of technical details, but what I'm saying is just simply moving would help. If you do with the rubber, exercising is good, but there may be a different intent. It may have a different purpose with the rubber. Got it?
Yeah, what could be that?
It can be for strengthening your back of your shoulder, what you call retractors. So strengthening the retractors, I can do this. I can show you that on the machine over there. Guys, are you ready for this simple stuff?
Okay.
Yeah? So what I want you to do is stand up from your chair and put the chair in front of you. Stand behind the chair, okay? So you don't fall off. Guys, no falling, and you take balance here, okay? So first one, I'm going to show you from the side, the calf stretch, right? So put one foot in the front, one foot in the back. The foot which is at the back, keep the heel down and the knee reasonably straight, right? Just watch me. And then move forward, like you were moving forward, you're shifting the way forward. And tell me where you feel the stretch. The front leg or the back leg?
Back legs.
Front leg or the back leg?
Back leg.
All should be the same, right? Hold it for a few counts. And come back. And now switch. And stretch, stretch, stretch. Keep the heel down. Right? Got it? Simple? That is stretching your calf muscles, right? You feel the stretch on the calf muscle. Now the hamstrings, a lot of ways of stretching it. I have tried hamstrings, so I may not be able to do many of the movements, but I can do the simplest one, right? In this age group, just leaning forward and stretching hamstrings becomes a little difficult. I may have back pain, I may not have balance, right? So what I do is I come closer, I can put my foot on the chair. Can you do that? Right? Yeah, just put the foot on the chair. So you can put it here. So we can do it together if you want. Yeah, right. Put on the chair and keep the knee reasonably straight. I cannot straighten fully because my leg is hurting or I have pain. The muscles are so tight. So I keep my knee reasonably straight and then just slide my hand towards the foot. Right? Go down, go down, go down, go down, and hold. Where you feel the stretch?
High muscles. High muscles. High muscles.
You will be feeling in the calf as well as the thigh muscles. We call them hamstrings, right? Now, there are many other ways of stretching it, and my staff can show you on the bed. Now, if this is not easy, if this is not doable, if you don't have balance, then you lay down and stretch your calf muscle. Somebody want to show up there? But I'll show you a little later. Let's just complete this and then, spinal extension, right? The one I was just showing it to him. Now, there are many ways of doing spinal extension. The easiest way for everybody is to stand against the wall, right? Right? I'm always bent, right? I just put my hands up on the wall, just watch it, right? And then bring one hand back. Not both, okay? Otherwise I'll fall backwards. One hand back, and then place it down, then other hand back. You'll feel the upper body is getting stretched. You need that, come. So I'll show it on you. So you need a wall, again, you're standing, just make believe you're standing against the wall. So put your feet closer to the wall. See now, if you're putting your feet closer to the wall, and then stretching backwards, where do you feel the stretch? Where do you feel that you are having a little pressure? In the back, right here, right? Come down. Why to do only one hand at a time? Yeah, so you don't fall backwards, okay? Otherwise you gotta relax. Good? Got this?
Yes.
Right? Very easy? Alright, come. Pectoral stretch, now people can show me that. He showed 2 times, the pectoral stretch, the stretching your near the door, right? We all know that. We all should do it. Everybody who sits, is there anybody who doesn't sit here? We all sit, right? So anybody who's sitting for a long time should do that pectoral stretch. And the rotation. Now the spinal rotation also, there are many ways of doing it. But the easiest way, like you sit in the chair, sit down in the chair, please. Now, rotation means, what is spine rotation in simple words? Is it's turning the spine side to side, you know. So swinging that, right? But if you are seated in the chair and you don't have too much of balance and you are fearful of losing balance if you're standing and swinging, you can sit at the edge of the chair, and then with your right hand, try and grab the left side of your chair, the upper part of the chair, see the upper back. So you put your hand down, right? Yeah. Over your shoulder, and then look at your hand. Just look at your hand. So I'll do it with you. So put your hand there, and look at your hand. Look at your hand. Keeping your feet where they are, right? Simple, very simple. Okay, relax. Now place your hand on your knee again, and turn. So you feel the stretch in the spine. You feel rotation here, right here?
Am I falling back like this?
No, so I'll come to you. You're rotating. So because your feet are moving, that's why you keep your feet steady. So now, keep your hand on the left hand on your knee, right? Keep your right hand, walk over the shoulder, and look at the chair. So stay back, go back in the chair. All the way. Okay, now forward. You feel? Now you're turning and forward, right? Now relax. Now put your hand there. Bring the other hand out. And hold. And look at your hand. You have a Rolex. I can look at the Rolex. You feel the stretch? So what you're doing, you're keeping your feet steady and moving. Now, spinal rotation too. If you lay down on the bag, there are many. I'm showing you things to be done on this chair. Otherwise, if you lay on the mat, we can show many other ways of stretching the spine, right? Good? Relax. But so these 5 things are, how would I put it? जैसे आप curry बनाते हो, तो curry में you put something. All the curry needs some common tarka, right? Spices. So same way, these simple stretches are easy to do, and they will not harm you, even though you have any back condition. Like you have back pain, neck pain, it will not hurt you, right? So, having strong core muscles is the key of keeping the spine under control. What I showed you was just general mobility exercises so that you don't spoil your spine. But then if you want to go to the next stage, there are many other sort of protocols which you can follow to keep the spine strong. And the doc was talking about, Dr. Wasil was talking about intense exercise, right? And one of the examples, if you guys remember, because there were a plethora of slides, was weightlifting. So the question to you, you have never gone to the gym, you have not been trained by an exercise expert. Can you do weightlifting today at this age?
I will recommend against that.
One form.
Yes or no?
Yes.
Not a
How many
big,
people say no? Anybody who says yes?
not too heavy, but up to 2
So
pounds,
I will
20
say
pounds,
yes, yes and no.
granite, yeah.
Yes and no.
Yes.
If you want to retain your bone health, some form of lifting is a must. Lifting weights, the cuff weights or the barbells can be done at any age, but I would start with lifting our own body weight, right? Start with lifting our own body weight. Have you heard of plank?
Yes.
Yeah? Yeah? How many people do plank? One. You do plank? Okay, let's challenge. We have 2 young ladies doing plank. You want to accept a challenge? Then let's do it together. Yeah, let's see who beats who. Come.
Not much.
No, but what? How many seconds of plank? Let's come. We have a clean mat there. Come on over. Just be seated there so you can watch. So you know.
Just want to say that high intensity exercise you should do under supervision.
Okay. Oh, so
That's my message because otherwise you won't do it.
Okay. So let's do it together. Face this side and get into a plank. Get into a plank. Right. You hold. All right. And I'm not gonna instruct you. I'm just gonna count for you. Right. 1, 2, 3, 3.5, 4, 5. Guys, count, okay? 6, 7, 9, 11, 13, 15, 17, 18. Very good. 19. Take your tummy up. Take your tummy up. 21, 23, 24, 25. If this guy reaches 60 counts, you gotta give a big round of applause, okay? 28, 31, 33, yeah, 39, 36, 41, 43, 45, 46, 50, wow, and 60. All right, guys, relax. So, I feel these ladies are stronger than normal people. Very good, very good, very good. So, I think they did it correctly. I'm just gonna review the plank technique for a minute, and if you may, just correct me if I'm wrong. So, when you do a plank, it's very simple. You come down. If you have never done the plank, you can do halfway through, okay? You can put your hands like that, keep the knees like that, and, you know, rest your hands comfortably. Start like this, okay? As you get better, come on your toes. And while you're doing that, don't let your back sag, right? You hold up, hold it tight, and place your palm down if you want. And then start holding, okay? While you're doing it, look just a little above, like 12 inches, okay? There's no money down, so you can practice that at home, right? Anybody can do it here? Anyone else wants to try and learn? These ladies can teach. I can hire them for staff, right? All right, go ahead. Let them try. Okay, yeah, relax your hands, come on your knees, and then gently come on your toes. Now bring your knees up and hold. Then breathe gently now. Okay, don't hold your breath too much. 1, 2, 3, 4. Excellent. Give us 10, okay? 6, 8, 11. That's it? No, hold it. If you can hold it, hold it. If you never did it and you're doing it, it's a great start.
It's harder than it looks.
No, it doesn't. It's not
harder
easy at
than
all.
it looks.
Yeah, I
It
agree
looks
with you
so
completely.
easy.
And if you do this regularly, believe me, you'll be 90% ahead of the rest of the people. Okay, relax, relax, great. All right, guys. So why? Because everybody talks about being healthy, but they just talk. If you do this, you'll be ahead of 90% people around you, okay? I want to acknowledge, have a seat please, have a seat so we can all complete the talk. So, coming back to Dr. Wasil, so see, it's a, managing stress, it's a big thing. Exercise will help you manage stress. And as a matter of fact, yesterday only, while going through all the social media scrolling, I'm also guilty of doing that. No saying. But what I say that there are a couple of people talking about it publicly that hey, when I was depressed, besides going for all the sessions, exercise, sports helped me. So get into exercising. It's never late, and you have examples, shining examples. You have two people who they show that they are doing something. You cannot come and fake this, by the way, okay? You cannot just wake up today and say I can do 60 seconds plank. You cannot fake it. You have to practice that to be able to do it. So you have examples in front of your eyes. Now the question is, what would you do next from after you learn from here, right? So one more thing, the doc has a book. Go ahead, doc.
So this has most of the information which we have talked about, a lot more than that. Actually, I was just going to come to his point that effect of exercise on eating, effect of exercise on stress, effect of stress on eating and exercise. So it's all basically interlinked. And if you are stressed out, you don't like to eat healthy and you don't want to do exercise. And you just want to get into this. There's a vicious cycle and then there's a virtuous cycle. If you feel that you get motivated somehow, start doing exercise, your stress level goes down, and then you start eating healthy also. So it's a virtuous cycle, but the vicious cycle is much more common. Chronic stress, unhealthy eating, and lack of exercise. And this book has many pictorial cartoons showing that what kind of exercise you can do, what kind of healthy American plate versus typical Western diet, the differences, and also some of the things chronic stress can do, the foods which we should be avoiding or minimizing. I mean, avoiding sometimes is too much, and all the cartoons with the cancers which can happen because of just being overweight and other things. And all these are very simple, although unfortunately you can't avoid all the technical terms, but at least I've simplified in many ways, or tried to simplify it based on my experience with the patients and stuff. And several of my patients have tried this, and they were asking me for handouts. That's why I wrote this. Actually, I've been doing these programs for a few years now, and people were asking me for handouts and the slides. So that's why I wrote this book. So basically, it's available on Amazon. If you ask Nilesh, we can certainly get those here for you.
Okay. Well, again, and many of you just RSVP through personal text or WhatsApp, and some of you have professional interactions with us, so you are here. We would like to know anything you want to learn in future. Not the salsa dance, which I cannot teach, but anything to do with health. We can team up and bring you information and some takeaway points. Every time you come, the guarantee would be you learn something from us, which you can practice when you go home. So just feel free to suggest us. We will be glad to come up with simple such seminar modules to have fun with you guys.
What do I ask? Sorry.
So everyone has known, or many of us have known about these things, but I think lack of practice has been the problem. As Nilesh was saying, that 7 weeks of exercise program, if you do 12 weeks of healthy triad, you will feel a difference. That's what my patients have done it. 12 weeks, just 12 weeks of healthy control your eating habits and do some exercises and some kind of stress coping mechanism. Just listening to good music or watching funny shows, that's the easiest thing we can do. Meditation, there are so many different types and people get lost into the, I guess, the complexities of it, but certainly prayers can help. And but listening to good music, massage therapy, and I think exercise, these are 3 or 4 good things which you can do. And these just do it for 12 weeks and see the difference. You might lose weight, and it's the fat weight you will be losing, not the muscle weight, if you do exercise, correct?
So talking about the funny tape, I was watching my wedding video last night. So, but anyways, any comments? See, can we eat healthy together? Did you see the example of being healthy? Did you eat healthy today? You feel? Do you feel guilty after eating what little food you ate?
You will start liking it after that. After 12 weeks, you will start liking the good stuff. You had a question.
Yeah, is stress mental or physical, or it starts mental and then it goes?
It starts mental, as I showed you. It's interaction with the environment and perceived stress. See, Monday morning heart attacks are very common, although people are in perfect health, but Monday morning they perceive the stress of going back to work. And this is what I see in my office also. The staff looks at the schedule and they start having palpitations. Oh my God, I have 40 patients to see. That's the kind of, it's not a stress that anyone is giving them, but just look at the stress and they perceive that something horrible is going to happen. So that's the kind of, it starts with the brain, then it affects our other cells of the body in a bad way.
Yeah, sure.
Is the swimming exercise or not?
Yeah, but real swimming, not in the thought process of
Leisure swimming is not.
Also, aqua exercise is good.
So yes, so there is a benefit of doing exercise in the water. The buoyancy of water will cause less stress on your joints. But nowadays, means we have, I don't want to talk too much about our equipment, but we have a AlterG treadmill, an anti-gravity treadmill. It does the same thing. It reduces the stress on your lower extremity joints. It basically unweighs you. When you exercise in water, it unweighs you. And if people who are not swimming, they have no skills of swimming, or they don't want to get the whole elaborate process of getting wet and change and all, we have equipment nowadays which unweigh you while you exercise. It's called, it's a AlterG, it's a kind of a treadmill. We do have that.
Coming back to stress and exercise, I just want to tell you this is what I learned from my staff at work. Again, we have 40, 50 people. So everyone wants to go to the gym, and their shift ends at 6 p.m. so they have to go to the gym. What I used to see was that at 3 p.m. they were getting stressed out. I have to go to the gym, I have to go to the gym. So I was telling them that you're harming yourself by doing this. You have to go to the gym at 6, at 3 p.m. onwards, you are just stressed out about this, what good you are doing to your body. So you have to be careful. You don't want to do the exercises, but you want to relax yourself. You don't want to stress yourself throughout this.
Good. Any other questions, guys?
Yeah.
Yeah, one more. You have.
So about chronic sleep deprivation, like if you try to sleep and get 6 to 8 hours of sleep and you wake up in the middle of the night and no matter what you do, you can't fall asleep again.
Right. So there are other mental health providers who would help you, or people who have been dealing with insomnia will help you. But from the physical point of view, physical activity is a great aid to improve your sleep patterns. You do consistent physical activity and then you monitor whether I'll give an example. I'm going to bed at 10 p.m. every night, and say I never move after eating my dinner at 9 p.m. and then I'm feeling uneasy at night. That's one way of watching myself. I move my dinner out or increase the level of activity after the dinner and see what it affects, how it affects my sleep. That's one way. The other way is the overall day, right? I'm walking 2,000 steps versus 10,000 steps and see how it affects my sleep. You can do self-monitoring by looking back of your physical activity pattern in the last 24 to 48 hours. Log them in, write it in for a few days, and you will start noticing, hey, is activity helping you? So do common sense and easy stuff first before reaching out to professionals. And believing in that activity will change my sleep pattern. Because once you have a preconceived notion that nothing is helping, we end up with that, because we already have the result. We are shooting for the results, internally, and our cerebral brain, it works to get there instead of having the change.
Some simple things such as walnuts. If you're not allergic to nuts, walnuts, soak them in water and eat them 1 hour before. It has magnesium, natural magnesium. Cacao powder, that also you can have it in just lukewarm water 2 hours before. There's no sugar. There's sugar-free, totally sugar-free cacao powder. So CACAO.
Cacao powder.
And
from where the chocolate is made, without sugar.
There's no natural caffeine in cacao powder?
No, actually it has magnesium and it can make you sleepy.
Yeah, the reason is I bought it, and I was going to do what you're saying, but I was just curious.
So no refined sugars. And
You're saying something? You had a question?
Yeah, I have a couple of questions.
Yeah, go ahead.
Knee replaced. And when you step up and down, this knee stop has squeezed and just like pulling the spring and is no pain. The one is 2 years and the one is 1 year. So what is the remedy for it?
So he has a question saying that he has 2 new babies in form of 2 new knees, right? Artificial joints, right? And while negotiating stay, he's having trouble. He's still feeling sort of, worked at, stressed physically, while he's feeling pull in the knee. So the knee replacement surgery is the beginning of a journey. It's not the end. So that's very important to understand. So after the knee surgery, or even before, now we have prehab, we call it prehab, you need to condition yourself. So when you stand, walk, climb stairs, dance, all the load applied on the knee is fought by 2 team members. One is the internal architecture of the knee, and the other one is the muscles controlling the knee. Now, you already got damaged internal architecture, that's why you went and replaced the internal architecture, right? Now, the second team member are the muscles controlling the knee, right? If they are not conditioned and strengthened, then they don't control the knee. That's where you have all these efforts and strain and feeling of excessive pressure, because those muscles are not conditioned. So the right thing for you to do is get sort of assessed for the knee strength compared to your core strength and work on it. And everybody here, who's not aging here? We all have effects of sarcopenia. We all have effects of having less soldiers going to work, and the current soldiers we have in our legs have not been as strong as they are supposed to be, right? In your peak, in your youth. So we all go through that aging process. Nothing bad about it, but being cognizant about it and working on it will help you. So knee replacement, anybody having knee replacement, hip replacement, shoulder replacement, you need to condition yourself periodically. And I would want you to go to a professional minimum every 6 months and get conditioned, not do things, on a routine basis.
So I tell my patients who are going for knee replacement that knee replacement can help you this much, but later on or before that, physical therapy helps you this much. So people think that knee replacement is a magic. It's going to just convert them into a marathon runner. That's not
the stress. But here, as I recollect in your presence, Nilesh, all the important topics were touched upon, whether it was sleep deprivation, whether it was food habits, and of course the laziness was the key factor. But now that Shrutiji must have observed you at other seminars also, but today, what was your impression about the way it was conducted? And now, of course, it's a beautiful space.
क्या होता है कि हर बार उनका जो भी टॉपिक होता है it becomes very interesting, so I love to join his topics. Or every time when I come, I learn. Even though I'm his wife, But every time when I come, I learn something new, and it helps me a lot, and it helps my kids also.
So you made a lot of husbands jealous, Nilesh, including maybe film stars would also not be able to say what she said for you, and that reminded me of Govinda and others. And so, but as we conclude this, there has to be one sutra from both of you for those of our viewers who are listening to you, and of course they get to see the glimpses of the whole seminar.
Healthy triad.
Spell that more.
Healthy triad of good nutrition, coping with stress, and exercise.
Wonderful.
And live life with purpose.
So I found that purpose by being here, that you become like a cycle of a yajna. So maybe more of you are getting to hear and probably incorporate a tiny little bit or even practice more and be more happy. And we want the world to be more happy and healthy. Shrutiji, Nileshji, and everyone, Dr. Tarun, thank you very much.
Thank you. Thank you, Ashokji. And the weather and all the rain. I know there were barriers for you guys to come here, but your presence here will energize us to do a little more like this.
Thank you very much.